Time for our weekly Health Watch discussion with Dr. Syed Hussain from Trinity Health of New England. And we were talking about the reemergence of polio as the state of New York has actually declared a state of emergency due to an outbreak of the disease. And it sort of brings up an irony regarding vaccination and vaccination rates, in that if you do a good job, you can eradicate a disease, but then, as it turns out, people forget just how bad the disease was and why you need to be vaccinated. And sometimes when vaccination rates lag, now you've got the problem again, like New York has with polio, as we welcome Dr. Hussain. Good morning. Good to see you again, sir.
Glad to be back.
Just where does New York stand? How concerning is this?
So I think it's a good move by the governor. It hit early, hit hard. They're looking at wastewater surveillance, Tim, which is an important tool that's emerged during this current COVID-19 pandemic to track disease, to track what's coming down. And the wastewater surveillance has indicated that polio cases are now spreading, at least been detected, in more counties than the initial county where the first case was detected after more than 10 years in the U.S. in July. So what this means is we need to ramp up our public health apparatus to ensure that we educate people and, of course, roll out vaccinations. So if you look at the counties where we're picking up these cases through surveillance, they're counties which have a lower percentage of vaccination rates compared to the rest of the state.
What would you define as lower? Do we know what the rate is where it can take off again?
Less than 70%, 60%. So we have large chunks of people that are unvaccinated, and it's a matter of time before we start seeing cases mushroom if we don't take action now.
And people being paralyzed as they have in the past. This is something that people in the mid 20th century very well aware of. Just how often do people wind up with that kind of bad outcome when they contract polio?
So a large chunk of people will either be asymptomatic. Usually this disease is seen in children. That's why it's part of the immunization schedule right now under the age of 6. And some patients may develop stomach flu-like symptoms, nausea, vomiting, those types of symptoms. And then in a very small subset, they will develop a paralysis or weakness of either the legs, the arms, or both. And unfortunately, some people will die. So it's, again, something that where we know vaccines have been highly effective and safe, and we've been able to control this disease to a large extent in the developed world, but now we've seen a little bit of a uptick.
Okay, real quick, while we're talking about the flu, we've talked about it before. Why is now a good time to get a flu shot, and should you be getting a flu and COVID booster at the same time?
So the short answer to the second question is yes, you can get both of them at the same day. The reason why we're emphasizing flu right now is because we've picked up clues from the Southern Hemisphere, which we always do. We track what's happening in Australia and New Zealand every year. They're now emerging from their worst flu season in 5 years. So we need to learn from that and make sure that we roll out our vaccination campaign early. We educate people. The seasonal flu vaccine is now available, in addition to the newly formulated COVID-19 booster, which Australia, by the way, did not have, which we do have in our arsenal.
Okay, see, there you go. This is the power of surveillance, whether it's wastewater with COVID, with polio, whether it's looking at what Australia is doing to know how our flu season is going to go. People, smart people, using their brains, putting brain power together can do some great things. Dr. Hussain, thank you again for joining us.
Thank you.
We will see you again next week.